What's up, you guys? It's Dr. Jake Giese, physical therapist, certified personal trainer, and I help hikers, backpackers, and outdoor enthusiasts stay pain-free and on the trail. I know I have helped a lot of people out there that are mountain bikers, paddleboarders, you name it, climbing mountains, and a lot of those people have back pain. So today, what we're going to walk through is a step-by-step process that I use with my personal clients either in the clinic or online to help them manage their low back pain. This is this initial assessment to use to determine what is the main cause of your back pain and can you treat it either online through some sort of service, or do you need to see someone in person, or do you need to see a surgeon? This is the exact blueprint that I use in my clinic and online to help people. So this same thing can also be found in my ebook. Go ahead, check in the comment section and the description below, and you'll find a link, and that will allow you to put in your information. I'll send you that ebook right to your email. So if that's something you're interested in, you can also check that out and get a printed out copy of the exact exercises that you should do along with this assessment. So go ahead and check that out below. All right, so now let's get into it. So first off, if you have low back pain, we first need to talk about how long has this back pain been going on for. Has it been going on for just a day, a week, months, years? Then the next thing to think about is, do we have any pain with a specific motion? So as physical therapists, we're looking for a reason of why you might have had back pain. So some sort of mechanism of injury, we call it. So the most common mechanism of injury when we are having back pain is one, if you're in the Midwest like me, shoveling. Then you can also have golfing, right? A lot of twisting motions, mowing the lawn, picking up heavy objects, right? All those things usually cause back pain. Maybe even if you're moving a kid into college or something like that, that motion of doing something new, whether it's a new twist, lifting something heavy, maybe it's all three or all of them, where you're lifting something heavy, something new, something awkward, you're bending in a weird position, maybe you're twisting, that might be causing you pain. That's the most common reason why someone comes in with low back pain, is just muscular pain, either a strain or just a little bit of like a flare-up or something like that that was already there just from doing a new motion. So in order to screen that out, we're going to do a quick assessment. First, we're going to do flexion. So what flexion looks like, it just means that you're bending forward. We're just going to go ahead and touch our toes. I want you to go ahead and look at what your low back is doing and your upper back when you do this motion. Is your upper back arching and your low back is flat, or is your low back arching and your upper body's flat? Are you getting bent knees? Are your knees bent, or are they straight? If something looks like it's flat, then usually we're not getting a lot of motion there. So say your low back is flat, but you have a lot of arch in your low back or your upper back, that means that your low back has limited flexibility and your upper back is doing most of the work. If you're bending down and you find that you have maybe bent knees here, maybe you have tight hamstrings and you're not able to get down because you have tight hamstrings. So a lot of things to consider there. Okay, so then next we're going to go into our next motion. You're just going to do a little bit of a side lean. Your hands are at your sides. You're sliding that hand down your thigh, seeing how far you can go. You should be able to get somewhere between a 20 to 40 degree angle. And none of these should really be painful. I also want you to keep in mind or record if any of these motions are painful, because it'll help you at the end determine what's really going on. Next one, twist. So I'm kind of doing these in order of what causes people to have pain. So flexion, the first one is usually pretty good unless you have a herniated disc. Second one, going down your sides, can be discomforting, but usually tolerable for most people. Twisting, this one can be painful, but that's why we're putting it towards the end. We should be able to kind of switch and twist around so that we're almost perpendicular with our hips. So our hips are straight ahead and then our upper body is turning completely. We're not turning our hips. And then the last one, probably the most painful one for most people, is going to be arching your low back. So hands are on hips and you're just arching the low back. And most people will probably feel some sort of pinch in their low back down there. Okay? So record which ones were painful, which one did any of those feel good? Do you have any numbness and tingling with those positions? And then if you do have pain, give them a severity. Is it super severe, like where you cannot go into that position? Most of the time you'll know. Otherwise, is it just kind of discomforting? So if it's just kind of discomforting, you might just have some muscle tightness. But if it's super significant and it hurts a lot, I would suggest stay out of that motion and go in the opposite. So that is the thing that I want to talk to you about next. If you're having, say, pain in extension, what we would then start you off with first is doing activities where you're doing bending forward. So you're doing the opposite motion of what hurts you. So then you do that motion, you move and move and move until kind of then you can eventually start going back in those directions where you had pain. So we're initially avoiding the painful area, but then we're going to slowly work our way back to doing that activity so that we don't ever just fully go in one direction where we're like completely avoiding extension or rotation or whatever motion bothered you. So in the PDF that you'll find below, you'll find specific exercises and positions that will do the opposite of those positions that may found pain. You'll find specific recommendations as far as the exercises are concerned, what exercises you should do, what your range of motion should look like in each of those positions, and then what you should feel in each of those positions. It'll give you specific recommendations and exercises that you can do to help you feel better. If that doesn't work, please either comment below, send me an email, or go to my website, flexforwardpt.com, all one word, and you can go ahead and fill out the form and try to talk to me there. I'm trying to help out as many people as I can with low back pain, stay pain-free and on the trail. It's one of my biggest ambitions because I am sick and tired of seeing so many people get injections, medications, and getting unnecessary surgery when they really don't need it. So this video is for all those outdoor adventurers that are in pain. Please, I hope this video gives you a little bit of direction, helps you move in the right direction moving forward, and you don't have to go down that route of medications, injections, or surgery. Now, I want to just touch real briefly when you would need to talk to a physician or something like that is, obviously go ahead and do that if you want to. Oftentimes, the MRI, the X-rays, all those routes that you're going to be given are just going to tell you what is going on structurally in your body, but it's not necessarily going to describe your pain. So keep that in mind. I hope you enjoyed this video. If you liked it, please go ahead, like I said, and like, comment, and subscribe. It helps out tremendously. Go check out that ebook below. You can download it, and it'll give you all the recommendations you need. Otherwise, feel free to reach out to me for any additional recommendation, maybe some extra help. I do provide online coaching specifically for outdoor adventurers that are struggling with any pain, but specifically back pain, neck pain. Those are my areas that I really specialize in. So if that is you, please go ahead and comment below. I'm hoping to, in the future, be creating a little bit more free content, such as a happy back, kind of a stretching mobility program for your low back. It's be a free program for 14 days. It's yet to come out, but if that's something you're interested in, go ahead and comment below, say interested. That would really help me out determine if this is something that I should put my time and effort in. I want to provide free content to help you guys solve your pain and stay that way, because so many people have gone down the route of medications, injections, and surgery, and they still are in a lot of pain. And I see them usually before, maybe even during and after, and a lot of the times they aren't that different. So they're still in a lot of pain, they're still taking medications, you're still getting injections. So even after they have done it before. So if this helped at all, please go ahead and like, comment, and subscribe, and I'll see you on the next one.